Hi everybody and welcome back to Learning Moments. I'm Ron Merck, your host. Today we're talking about what happens quietly in hospitals across British Columbia, but it carries enormous weight. It's the moment when somebody with an opioid use disorder walks out of the hospital doors after being treated for possibly an overdose or an infection, even a broken bone, something that got them into critical care. Eventually they head back into the world, and that's still dangerous, still uncertain, and for many it can be deadly. What happens in the first 72 hours could determine whether they live or die. And the most powerful thing we can do to protect them, give them 3 days of medicine before they leave. That's it, 3 days, one prescription, a bridge to safety. Today we'll look at why this window is so critical, how the system is and isn't responding, and what families, friends, and even healthcare workers can do to close the gap that's costing lives. Let's start with the numbers because they tell a heartbreaking story. In 2023 alone, 2,511 people perished in British Columbia due to the poison drug crisis. That's more than 7 people a day. Yes, 2024 and hopefully 2025 are going to be better, but still we're hovering around 5 people dying or passing away every single day. Think about that. They survived the overdose, they made it to the ER, they got care, but then they went home and there was nothing to keep them stable, no medication, no appointment, just hope. And hope isn't enough when your body is screaming for relief and the street supply is laced with poison. Here's why those first 72 hours are so deadly. During a hospital stay, a person's tolerance to opiates drop really fast, even if it's only a few days without using. It can make their body far more sensitive. But cravings don't disappear. They often get worse. So if they use again, even at the same dose they used before they entered hospital, it can be fatal. Remember, this is not a moral failing. It's biology, and it's predictable, which means it's preventable. And we already have the solutions. Medications for opioid use disorder, like Suboxone, which is buprenorphine and naloxone together, or methadone. These aren't replacements. They're life-saving treatments that reduce cravings, prevent withdrawals, and dramatically lower the risk of overdose. The best time to start them? Often it's in the hospital, when somebody is already in care, already engaged with the health system, and ready for help. But here's the problem. About half the people in BC who are discharged after an opiate overdose or for some other reason, but they have an opioid disorder, they don't receive any additional medication at all. Why? Sometimes it's because staff don't know the rules. Sometimes it's because the clinics are full. Often it's because weekend and holidays create a gap. No pharmacies open, no clinics accepting new patients. And if you leave the hospital on a Friday with no medications, you're on your own until Monday, if you survive that long. But it doesn't have to be this way. In British Columbia, any licensed doctor can prescribe Suboxone. No special training, no extra paperwork. Hospitals can send patients home with a 7-day supply, just like they would with antibiotics or blood pressure med. For methadone, the rules are a little bit stricter, but even then, federal guidelines allow hospitals to give up to 3 take-home doses if someone is discharged before a weekend or holiday. These come in a sealed, labeled pink bottle from the hospital pharmacy. They're safe, they're legal, and they keep people alive. All of this is called bridge prescriptions, and it works. At St. Paul's Hospital in Vancouver, they started giving patients a 5-day Suboxone bridge before discharge. The results? 70% of patients showed up to their first community clinic appointment, double the rate before they implemented the program. That's not just statistics. That's 7 out of 10 people staying connected to the care system, staying alive. But not every hospital does this consistently, and that's where families come in. You don't need a medical degree to advocate. You just need to ask the right questions. Before your loved one leaves the hospital, make sure they have a prescription for at least 3 days of medication, a confirmed appointment with a community clinic, a naloxone kit, and a safe place to stay that night. There's even a simple checklist developed by frontline workers and families that cover all the essentials I just talked about. Medicine dose, pharmacy info, 24-hour support lines, peer support contacts, and more. And if the hospital says, well, we can't find a clinic, don't accept that. Call 811 or contact your local RAM clinic. That's Rapid Access to Addiction Medicine. They take walk-ins, and they can often see someone within 24 hours. If they say pharmacare won't cover it, that's not true. Both Suboxone and Methadone are covered in BC, and if there's a delay, hospital social workers can help enroll them on the spot. One of the most powerful lines I've heard came from a mother of a young man named Jordan. He was 24. He overdosed in Surrey, was revived at Royal Columbian Hospital, and even started feeling better on Suboxone. But when he was discharged on Friday with no weekend appointment and no bridge prescription, just a phone number, he used again on Saturday, and he died. The mom said, if the hospital had just given him a week of medication, he'd still be here. That sentence should echo in every emergency department, every hospital ward, every policy meeting in this province. Because this isn't about a complex new treatment or expensive program. It's about doing what we already know works, consistently, compassionately, and without delay. So whether you're a nurse, a doctor, a social worker, a patient, a sibling, a friend, a family member, your voice matters. Advocate, insist on the bridge, because 3 days of medicine might not seem like much, but for someone walking out of the hospital into uncertainty, it can be the lifeline that keeps them alive long enough to heal, to reconnect, and to find their way forward. Thanks for listening to Learning Moments. If this episode resonates with you, please share it with everyone. You never know who might need to hear it. And remember, care doesn't end when the hospital doors close. Sometimes it's just the beginning. I'm Ron Merck, your host at Learning Moments here. Stay kind, stay informed, and keep showing up for each other.